Sit, 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 sit.
Good morning. So nice to see you on a Friday morning. That makes it happy, doesn't it? Hopefully you have fun plans for the weekend ahead. If my hair looks a little bit flat this morning, it's because I just had the coolest experience, and wait until you get to hear about it. Dr. Troy White is here. He is with Dr. Troy White Eyecare, and he brought a device with him called
NeuroLens.
NeuroLens.
Yes.
So he was kind of explaining it to me, and in total fairness to you, I was interested, but I didn't fully get it until I put it on.
Yeah.
You were telling me that something like 95% of us are walking around with our eyes misaligned?
90% of patients have an eye misalignment, and most misalignment's greater at near when we go to read than it is at distance. That can cause symptoms of headaches, eye strain, eye fatigue, glare, even migraines are made worse when the eyes are misaligned.
Okay, so for people like me, you know, we all hear that once you hit 40-ish, you're going to have to start wearing readers, right? So I wear contacts.
Okay.
I don't really want the bifocal lens, so I have reading glasses.
Yes.
But even still, sometimes with that, my eyes feel strained.
Yeah.
Am I typical?
Yes, so what's cool about NeuroLens, the technology, we can measure the eye misalignment down to a very precise degree. And then we have a solution. The NeuroLens is an actual lens that helps with the misalignment. And for someone like you that wears readers, we could actually put that contoured prism in a pair of glasses that you use to read with over your contacts.
Okay, so the NeuroLens would be a set of glasses for me. It's not a contact lens option?
Correct.
Okay. So talk about what I experienced, because it was really like a Disney World ride.
It's pretty cool. So the technology now is in a device that's a virtual reality. So you put the headset on, and in that headset, you're actually seeing in this three-dimensional virtual world where it's actually measuring your eye misalignment at TV distance and then at near, like on a laptop or on a phone, a tablet, something like that. It measures that misalignment at near.
The way your body works is just amazing, and we're learning more and more the power of our brain.
Yes.
So your eyes can't function correctly. Your brain controls it, right?
Yes,
So this misalignment
exactly.
is a neurological thing.
It is. So when you're looking with one eye, your brain is seeing that image off. Mostly the right eye is off to the right for most patients, and left eye, the image is off to the left. So when you have both eyes open, your brain has to fuse those two images into one. Well, that takes a lot of effort on the eyes and the visual system.
Right.
When it gets overstimulated, overworked, the main sensory nerve of the head, neck, and shoulder is more sensitive to other stimuli, so that can lead to those symptoms that we talked about.
So, you know, over the last 20 years, you've heard more and more people talk about eye strain.
Yes.
And we've attributed it often to screen time. But is that really because the root of it is our eyes are misaligned?
You're exactly right. So the more time we spend on devices, more time we're looking up close, that just makes us more symptomatic. Computer use, tablet use, that's gone up to sometimes 13 hours a day for some people. That's a lot of strain on the eyes and the visual system.
I had a daughter once who went through vision therapy.
Yes.
And one of the things that we did a lot of these exercises and things, but then kind of resting your eyes was important.
Yes.
Is that also, even with the NeuroLens, you want to rest?
Yeah, so anytime we look up close, our eyes have to converge in. Well, those muscles get tired after a while. Imagine if I said, just hold a 5-pound weight, you'd say, okay, that's easy. Well, now hold that for 2 hours, for 3 hours, 4 hours. As you're converging and you're staying looking up close, those muscles are going to get tired and fatigued. Well, what NeuroLens Prism does, it basically puts the eyes in a better position where they don't have to work so hard. When they don't have to work as hard, then the symptoms decrease.
This is giving people their life back, though, a little bit, because especially folks might not drive at night because of the glare.
So I've had patients where this has literally been life-changing. At least once a month, I hear a patient that's had the NeuroLens. I've had it for 3.5 years. And so as patients come back, they'll say, these lenses have changed my life. Now, not everybody gets that kind of response.
Sure.
Pretty much everybody can get adjusted 95% of patients do well in it. And then I would say a good 20%, 15%, it's life-changing.
So when someone comes to your office, you're just down on Mountain Creek Road.
Yes.
Will they is this something that's just a rote procedure in your office?
It is. So we have a lot of high technology. We do retinal imaging where we don't have to dilate. For most patients, we'll run this is N3, NeuroLens device 3. We'll run the N3 on every patient, check eye misalignment, talk to the patients about their symptoms, and then see if NeuroLens would be a solution for them.
And I'll throw this out there too. I'm a tad claustrophobic. So when I put this on, there was a little part of me that kind of got tense. It's very calming. It's a very peaceful thing.
It is. They've done a great job of the software behind the device and making it very immersive for the patient. Some patients, though, that do have motion sickness, this will affect them, but we know now we have a solution for that motion sickness when they put that on.
Well, I did not experience that,
Good,
but it
good.
was, pardon the pun, but very eye-opening. So let me show you how you can get in touch with him. Dr. Troy White Eyecare down on Mountain Creek Road. The phone number to call him is 922-9293. Everything about that initial eye exam is going to be completely intensive for you to make sure that when you walk out the door, he knows everything he needs to know.
Yeah, we pride ourselves in being very thorough for patients and caring for their specific needs.
And I did have a misalignment.
You did have a misalignment.
Thank you. I'll be in to see you.
Great. We look forward to seeing you.